Well, good afternoon, everybody. Thank you for joining us for this afternoon staff chat. For those of you who've not joined us for one of these before, my name is Priscilla Andrews. I'm the clinical manager at the Cancer Wellness Center. The staff chat series was created back in 2020 as a way to give insight to our community, our participant community, insight into conversations between professionals, talking about topics of interest and of concern to those impacted by a cancer diagnosis. And I am thrilled to be joined today by Rebecca Abraham from Acute on Chronic. Thanks so much for being here today,
No
Rebecca.
problem.
Yeah. So just a little background on Rebecca. Rebecca is both the president and founder of Acute on Chronic, which provides educated guidance on cannabis, alternative therapies, supplemental treatments, and support in navigating the healthcare system. She's a registered nurse with 15 years of experience in, wow, there's a long list here, Rebecca, emergency medicine, critical care, heart failure, surgical services, and case management. She's also currently working on her doctorate in nursing practice, where her research is focusing on cannabis science, nursing, and the integration of cannabis into traditional healthcare. She's board certified in critical care, and also possesses a certificate in cannabis nursing through the American Cannabis Nurses Association, which I didn't even know about until I read your bio. So that is very cool. So thanks so much for being here, Rebecca.
Yeah, no problem. I'm really happy to be here. This is great. I apologize for the noise. I wanted to make this happen because I think it's such an important conversation to have, and it's not one that's very often had. So I apologize for the background noise, but it was very important for me to be here. So I wanted to make it work no matter what. So.
You know what, when you're talking, we can't hear it. So that just means you're going to have to keep us well informed today.
Yes, I'll just keep talking. It's fine. I could talk for hours. We could do 17 series of these. So.
Well, just to start out with, I always like to ask people that I'm speaking with kind of what drew them to this area of specialty. So I'm curious what got you involved in medical cannabis.
Yeah, thank you. I think it's a great question. So back when I was in nursing school, not that long ago, I was really interested in cannabis. I was working a lot in palliative care and in oncology as my senior clinical, and you have to find a policy topic. And at the time, I wanted to be a nurse lobbyist, and I did do that for a little bit. But my passion project was the legalization of medical and recreational cannabis, because at the time, there were no legal or recreational states. I did this entire policy project. I got an A. But some people were not too pleased with it. And then I spent pretty much most of my career in critical care and case management, secretly telling patients how to procure cannabis, how to use it. They would disclose that to me. I would, not tell anybody, but I would give them guidance, because remember, in the before times, there was a lot of stigma. So I was that ICU nurse where I would close the door and I would be like, all right, here's how we're going to do this. And it did help people. So I noticed as cannabis legalization started happening, both adult use as well as medical, there became this really large gap in care between the cannabis industry and the healthcare industry. I am married to a hospital medicine physician who primarily actually worked in oncology at Northwestern University for quite some time. And he said he was getting a lot of patients asking this question over and over and over again. And so that's kind of how this concept and business came to be, is there was really no trusted source for patients to get information about medical cannabis or even adult use cannabis. Doctors didn't want to talk about it. The cannabis industry didn't really have the nurses or doctors or pharmacists to address this. And so patients were being left in a kind of tough place. So that's where it came from. And it turned out this gap is huge and really needed. And we're seeing interest from both industries about the work we do. And we do research. It's really important to us to publish and show our results so we could prove something beyond a p-value if you're into statistical research, and something to also show legitimacy to what we're doing in cannabis medicine.
Yeah, that's so great. And I mean, it sounds like you've been involved and kind of passionate about this area long before Illinois got on board. And you said something in there. I just was curious, just if you could speak a little bit, I think, about stigma, because I think that is something that I see with the people that I work with, either their own sense of stigma around the idea of even thinking about using medical cannabis, or their concern about bringing it up with their doctor out of fear of the perception that there will be stigma about them even asking about it.
Yeah, so stigma is still a big deal. It's getting less so. There was recently a study done on MS patients and how often they disclose to their doctor that they use medical cannabis. Patients who have previously used cannabis are 70% more likely to talk to their doctor, but people with no cannabis use prior to becoming ill or in new legal markets will not talk to their doctors about it because they're afraid. Where do people get their information about medical cannabis? In the same study, most people get it from friends and family, Google, and then the dispensary itself. And the problem with that is in most states, in particularly Illinois, the dispensaries and cannabis industry is actually prohibited from providing any sort of healthcare or medical guidance. So if you are getting information from a dispensary, you shouldn't be. And then also, it's most likely given by somebody with no scientific background whatsoever. And while what makes me able to do my work is cannabis is a safe substance. That's overall what we know scientifically. It was used as a medicinal substance for 3,000 years. Prohibition was a short 75 or so years. And now we have a lot of studies. There's a lot of money thrown at looking at the harms of cannabis, and every time they can't really find any. There's very few kind of bad outcomes related to cannabis, but they keep finding more and more and more positives to cannabis. And there are very few products in healthcare or the pharmaceutical industry where we have looked for harms this aggressively and can't really find anything. You know, we always say there's no free lunch in medicine. Every treatment has a downside, but in cannabis, those downsides are relatively few if you know exactly, if you're getting correct guidance. So
yeah, well, and I think that raises an interesting point, which is just the use of medical cannabis to potentially treat side effects without having additional side effects that some of the medications that you would otherwise use cause a side effect, and then you're taking another medication to manage that side effect. I mean, I think in particular, I see that a lot when I have clients I'm working with that are dealing with pain issues. You know, the old GI symptoms crop up around that. And so you're kind of, you know, a snake eating its tail of just like robbing Peter to pay Paul, so to speak, when it comes to how to manage one symptom versus the side effect from it.
yeah, and that's another really great thing about medical cannabis, particularly in the oncology space, but not exclusively the oncology space. We see this in older adult care, dementia care, chronic pain, where there's polypharmacy has its problems, just like you said, you know, it's a snake just eating itself sometimes. Sure, you've solved your pain, but now you're nauseous all the time, right? Cannabis is a very useful substance because it can do multiple things at one time. You know, it helps with nausea and vomiting. It helps with pain. It helps with migraines. It helps with anxiety and relaxation. So that actually decreases polypharmacy. So when patients start using medical cannabis, with our group, we always connect to the physician, any physician that the patient wants, oncologist, palliative care, primary care doctor, and we go through the drug-drug interactions and tell them what could possibly interact. And there's actually over 100 drug interactions with cannabis. And when I say cannabis, think of cannabis as like the umbrella, and then under that umbrella, there's actually 162 different compounds. So that is THC and CBD. THC is the only one that alters. CBD is federally legal in all 50 states. THC gets kind of the bad rap for being the assumed one that interacts with everything, but it's actually CBD that does the most interactions.
Really?
So yeah, and that is available everywhere. Grocery stores, gas station, you know, you could throw a rock and hit 17 CBD companies. And it interacts with over 100 medications because it is metabolized in the cytochrome P450 system. That's where a lot of things are metabolized. So when we work with doctors, we let them know, like Lexapro and cannabis has an interaction. Xanax and cannabis has an interaction, and those interactions off the top of my head increase the circulating dose of those drugs. And when the doctor is clued in on this, they could start decreasing down the pharmaceuticals while we're helping with guidance to the patient.
Yeah.
And we have seen a lot of folks decrease medications, come off of medication, particularly in the oncology space. And sometimes just coming off or decreasing a medication is part of what makes them feel better, because they're not experiencing, the GI side effects, for example, of Norco. They're not getting obstructed. They're not getting constipation.
Yeah.
So it's really neat to see in practice.
I mean, what do you, when it comes to the within oncology, what do you typically see the ways in which people benefit from medical cannabis? And also, to be even handed, what do you see as some of kind of the considerations to potential cons, or kind of considerations to keep in mind when you're talking about using it while dealing with a cancer diagnosis?
Yeah, absolutely. So I'll start with the bad news first and go to the good news. So I'll sandwich it. So there are quite a bit of positives with Cannabis Care. And I'm actually going to use my own mother as an example. What's nice about that is she allows me to talk about her care. I'm not breaking HIPAA because she has full permission for me to talk about this. So my mom actually has been recently diagnosed with colon cancer. And I had one of our nurses guide her through exactly what our clients go through when they hire us. So I had my mom work with her, and she was a person who was afraid of stigma. Despite smoking cigarettes for quite some time, she was terrified of cannabis, despite this being I am a national expert in the field. And she was still like, I don't know about this. So it does take a bit for people to come to the other side,
Sure.
So the bad side. So if you are a breast cancer patient and you have been given tamoxifen, we do not know the interaction of tamoxifen with CBD. Old literature said that it turned off the tamoxifen. So the way tamoxifen is metabolized, it turns on in our liver. And there is a theory that CBD can potentially decrease that or turn it off if you take them too closely. Now, this likely happens in very high doses of CBD. So we're talking 100 milligrams, 40 milligrams, but we don't know. That was the old research. Newer research is now telling us that that might not even be true, and there might be actually a synergistic relationship, but we don't know. So have I had clients come through, use tamoxifen and cannabis? Yes, but it's a conversation with them about these risks and their oncologist and their care team. And we send them pages of research to let them know. And typically we go very, very low on CBD if the person is okay with this risk, right? And if their doctor's okay with it. Other downsides, overconsumption can feel uncomfortable. But the nice thing about overconsumption is you don't have to go to the hospital. You can't die from overconsumption. I often joke you could go to a dispensary, eat and consume everything in there, and there's no toxic dose. It would be uncomfortable, but you wouldn't die, right?
Yeah.
But it can be very uncomfortable and scary if you overconsume. So that's another downside.
And just to be clear, talking about the discomfort, we're talking primarily about kind of the psychological, emotional discomfort of being kind of too high versus some physical thing going on.
Absolutely. Most people, unless they go way overboard, only experience anxiety. Sometimes an elevated heart rate. Other downsides, so cannabis is a vasodilator, so it opens up all of our vascular structures. That can make us feel a little dehydrated. So this happens a lot more in oncology patients because their hemoglobin's low, their blood counts are low, so they're a lot more susceptible to dehydration, particularly in the setting of chemo. So it's really important to give fluids as possible, but we know in this population that sometimes that's really, really hard. So a really good solution to that I've found, actually, we'll talk about this more, is actually Cannabis Drinks for oncology patients. This is perfect. Like, my mom says everything tastes like metal now. She doesn't like food anymore. She's on her 7th cycle. And so I had her purchase literal beverage cans and, a mix, and it's to add to her water, and it significantly helped her. So dehydration, a little bit of an elevated heart rate, that's kind of it. And then the most problematic thing I've seen is actually the miseducation of physicians. So when the oncology patient goes to the hospital and they're having a problem, dehydration, sepsis, things related to their prognosis and disease process, pancreatitis, nausea, vomiting, the uneducated physician, yet well-meaning, will oftentimes find out this patient uses medical cannabis and say, aha, there's the problem. And they kind of skip over the other basic differential that's typically done. Ideally, the patient calls us and has us advocate for that, because there are two major things that could go wrong in cannabis care. Something called hyperemesis, cannabinoid syndrome. So this mostly happens to adolescents who are over consuming high dose THC recreational cannabis, where they start vomiting over and over again, and it only stops with stoppage of THC in a hot shower. Pretty rare diagnosis of exclusion, but physicians hear about this, and so they see medical cannabis, and if they see you vomiting, they might
just
say,
jump to that conclusion.
yes. So we have had a couple of folks who have been kind of unfairly pegged in multiple things. The other thing that's kind of disappointing too, and a problem in cannabis care, is when folks present with something, doctors get so scared that sometimes the typical rules of medicine go out the window, which is the most likely cause is the most likely cause. But when somebody has cannabis on board, I've seen physicians go to, well, I found one case study from 2012 that cannabis caused this, and so that must be what the patient has. And when you look at the case study and then look at the patient, you're like, no, but their acute symptoms are related to their cancer, not that 2012 case study on, what have you, was on a recreational user where we didn't know what cannabis they were consuming. It was off the underground market, and they were, it is not a 1-for-1. So we really have to push to advocate for people, because I don't want to see any more folks get kind of misdiagnosed with hyperemesis cannabinoid syndrome, while being a very real syndrome. It's just not happening as much as we assume. And it's mostly not recorded in medical cannabis patients, particularly in the oncology setting. So now for the good. So those are all the scary things. And then there's other drug interactions that I typically steer patients away from. Plavix, if you have had, unless you are on hospice or palliative, there's it depends, risk benefit, right? If you are not if you are in a silo and you've had a cardiac intervention and you're on Plavix, you should not be using cannabis, definitely not CBD, for at least 6 months to a year after that intervention. Now with oncology patients, there's a little bit of a different clinical picture, because we're talking to your cardiologist, we're talking to your oncologist, we're trying to get you through chemotherapy or radiation. So a little bit of a different ball of wax. And then Coumadin, you have to have close monitoring by a physician and nurse who's ordering labs, because it can increase the amount of Coumadin, which could make your blood very thin, cause bruising, head bleeding. Those are really the big things. Everything else can be worked on. So the good, what is the good? I've told you all the scary things. I promise that's it. We see benefits to oncology patients both during treatment and post chemotherapy. So the paresthesias people get post chemotherapy, we see help significantly with various cannabinoids. And when I say cannabis and cannabinoids, know that there are 161 molecules of cannabis that do not cause alteration or being high. That's only THC. And so you can absolutely use cannabis without the euphoria. It's not needed. We do have many people who work with us who never even touch THC, and their symptoms are pretty well controlled. So paresthesias post chemotherapy, during chemotherapy, I can't understate how much it helps people eat with early intervention. So no nausea example, my mom, again, she's on week 7 of her cycle of some pretty intense chemotherapy. She's getting 2 different doses of, I think she's getting, if you're familiar, 5-FU, because I know some folks here are 5-FU, I believe. And one of the other agents, and she has not had to use any of her pharmaceuticals yet for symptom control. She has Zofran and mirtazapine written for her, and of course pain medicine, and she's only used medical cannabis at this point, and she's nearly like almost completed with her chemotherapy. So early intervention, we're always trying to tell the palliative doctors and oncology doctors, like, please don't wait until the last minute, please recommend medical cannabis maybe earlier. And one of the projects I'm really passionate about is when I do my research is hopefully seeing that what happens when we start cannabis earlier in a course rather than later. I think it could really make a difference. Pain. So pain is huge. We have had many patients on methadone, Oxycontin, Norco, go from pain and being on many of these opioids to completely off with 0 out of 10 pain, able to decrease steroids if they were only being used to control pain. That's probably one of the most impressive things. And then the anxiety component, all cannabis, but particularly THC, CBD, and CBG are the main ones. They increase serotonin and dopamine, and those are our happiness molecules. Takes away some anxiety, and end of life care. So for folks on hospice, when you incorporate medical cannabis, it helps people use less opioids, as we see in folks who are not terminally ill. But using less opioids and more cannabis in end of life care allows those who are dying to be more alert during their last days. And we've had many, many families of patients who have passed tell us that they never thought they were going to get these last moments with their family. And thanks to medical cannabis, their family members were happy, they were laughing, they were awake, pretty lucid for a couple hours a day. And that's huge. That's really something, is giving people a really fantastic last 6 months of their life. It's so amazing to see. Like, anytime I feel, overwhelmed or sad about my work, or I have a bad day, I think about that. I'm like, no, it's all worth it. It's all worth it, for that.
It's that quality of life piece, right? Yeah. So I'm curious, like, if somebody is wanting to try to start a conversation with their doctor, maybe they're wanting to disclose that they've already been using it, or maybe they're wanting to move towards getting a medical card. How do you typically advise people bring it up with their doctor? Because I think that's something that I run into, is either one, they've tried talking to one doctor about it and it's went poorly, or they're kind of concerned by how the doctor will respond, or they assume that their doctor will be dismissive or critical of that. So curious about any tips that you might have.
Yeah, I think it's really important to remember, because unfortunately, I wish I can say that's not going to happen. It might happen. It really depends on the physician and when it does happen. So I always encourage folks to definitely bring it up, even if it seems scary. However, if you get a less than optimal response, if you're interested in a medical card, using medical cannabis, talking about how you've already used cannabis and it worked, that's a lot of times how people bring this up. They're like, I took a puff of my friend's vape and it helped my pain. What do you think? If you get a less than optimal response, the biggest thing to remember is this is not yet taught in medical schools. It's starting to be, but it's not. The entire system that cannabis works on is called the endocannabinoid system. It was literally discovered in 1990. So this has not been thoroughly vetted in research. We're starting to get there globally. Israel does a lot, Malta, Portugal, South Africa, Australia, New Zealand is starting to provide a lot of research and resources, but know that they're not taught about it in residency programs, very rarely talked about. It's starting to filter in, but it's still not as much as you would think. Same thing with nursing. It's not really taught in nursing schools. We're kind of slowly entering. So no, if you get a less than optimal response, they literally don't know. And when doctors leave school, sometimes they don't keep up as well as they should, but they certainly don't keep up in cannabis, because it's it's not a reimbursable, thing, especially if you're on the outpatient side. If you're not in academic medicine, they're just much less likely to discuss it. Definitely bring it up. And then if you've heard this talk and you want to bring it up, feel free to say, like, I did hear this was a very safe substance and there's no risk of a lethal overdose. And so that's a really good lead in. You could give them our name. We do free education for physicians all the time. I will talk to any physician anytime, because having nurse-driven education does sometimes get them to the other side. Because I know what they're worried about. They're worried about their DEA license. They're worried about harming somebody, because if they truly don't know, they do not want to harm you, right? And then litigation. So those three things are their main worry. We really help them come to the other side. I've talked to many doctors who are a hard no on it, and we give them an entire kind of grand rounds talk. And I'm like, there's really no side effects when you compare it against NSAIDs even. Very little side effects in comparison to most of the things that are being prescribed, and it's safe, and there's no withdrawal symptoms, and there's no lethal dose, and those things usually help bring them in.
Calm down some of their worries, the doctor's worries about what could happen. And I'm getting the impression that kind of helpful to go into maybe that first conversation with a mindset of, okay, this is going to be the first of maybe multiple conversations, or is this kind of looking at it as this is the first step in a process? And it sounds like helpful to be aware. I mean, I hear you talking about the resources that you can provide, but helpful to be aware that there are resources if that first pass is not successful, that just is saying, okay, what are my resources to help me move forward with this?
So quality resources for patients to look to. The Society of Cannabis Clinicians, there is at least one cannabis nurse in every state, sometimes more than one. Society of Cannabis Clinicians has cannabis physicians, and these physicians oftentimes work in academic medicine too, or regular medicine. They exist, they're affiliated with real hospitals, and they're fantastic doctors. So they will be there. Nurses will be there. Another great resource is Project CBD does a lot of very legitimate research, very well vetted out content that's not, it's not from a brand or anything like that. It's vetted. And then if you are into reading large scientific papers, throwing things into PubMed, there's a lot of meta-analysis out there. As well as a resource that my nurses use, but you can use it as well. It's just a paid subscription. That's pretty reasonable. I think it's about $70 a year, is CannaKeys. It is a database that only houses cannabis and cannabis-related research in it. It's a fantastic resource, pretty easy to read, but those are kind of the main resources I go for, because, unfortunately, there's a lot more unofficial resources where the science is kind of pseudoscience-y than there is, professionals and science. We are here globally, but it's such a small number of group that most of us globally actually even know each other. So
oh wow, okay, it's an international community.
Exactly.
You're right on. You're in the ground floor right now, right?
Yeah.
Of what will probably be a giant skyscraper in the years to come.
Yeah, and it is getting this is going to move. We're going to make progress, and we see this also in the psychedelic space too. We're seeing that take off.
Yeah.
In 5 years, I suspect that people will be so much more educated. So know that it's every day this gets better.
And I will just say to our audience on the psychedelic assisted therapy, that was my guest in July. We talked about psychedelic assisted therapy. So if you're interested and want to know more, what are they talking about, go to the YouTube channel and you can hear the conversation between Gabrielle Walk and I on that. I'm mindful of the time. So I kind of wanted to circle back to something that you mentioned earlier, which is, I think the challenge of walking into a dispensary, especially now there being you know, a lot of just recreation only, or maybe recreation and medical side, and being a bit overwhelmed by the different products and where to start and what's going to be a good fit for me. So if people are trying to wade through that, you know, I think especially sometimes people being hesitant to like use a vape pen or use flower, they don't want to smoke anything.
Yeah.
I'm curious where you direct people or how you direct people to sort of figure out what is a place to start.
Yeah. So if you're on your own, so the optimal way is to see a cannabis clinician, have an assessment done, have everything gone over, and then
And
get
that's something you guys do.
Yeah.
Like if somebody is looking for that, that's something acute on
Exactly.
chronic can
And
provide.
that's something, and not even without us, there are other cannabis doctors who do this, other cannabis nurses. So if you don't have that, which many people don't, so route of administration, dosing, ratios, added terpenes. Terpenes are the essential oils of cannabis, flavonoids. All of these things work on our endocannabinoid system to give us an optimal result. So let's say you're going into the dispensary all by yourself. I would say gummies are the most popular with people. It's what they've heard of. Don't not at first, actually, not unless it's 2 milligrams or less, honestly. Because if you're a new cannabinoid user, a THC dose of 5 milligrams could be too much. 10 milligrams could be too much. So the overall advice is start low, go slow. And I honestly recommend starting at something very, very low. Now, oncology patients, what I've actually seen is oncology patients, chronic pain patients they do have a pretty high tolerance for THC because of how our pain receptors work. I have seen people have decreased pain on 20 milligrams of THC and not be altered at all. Whereas you and I, we would be in trouble. We would be in that anxiety.
I was going to
like...
say, I think the term that came to my mind was higher than a kite, to be
Yes.
perfectly honest, Rebecca.
Yes, exactly. And we would be a mess. And we would be an uncomfortable mess. 20 milligrams might even be enough to elicit vomiting in you and I. So starting low, going slow is really important. I would say also look for something called certificate of analysis. Every dispensary should have them, or every product maker should have them. What that is, and this is really important for the oncology community, is it is typically about a 6-page lab report that says if the product you're using is legitimately cannabis and it has actual cannabis in there. And this exists in the hemp market. So if you go to Osco, Jewel, and you buy CBD, the company, you should be able to write them a letter and they should be able to send you this. If a company can't give you a COA, you don't want to use them. Cannabis is a very porous plant. It sucks up heavy metals, bacteria, fungus from the ground. You do not want that if you're immunocompromised. So looking for clean products, getting that 6-page report is really important. That's another factor that folks need to be on the lookout for, starting low. And then route of administration, there's plenty. There's 13 total, but the creams are really effective. A lot of people think they don't work. They do, and it's not a placebo effect. We have receptors on our body right here. Patches can be great for folks. Oils are great. And some folks, vaporizing can be pretty effective. Smoking, if you're, for example, if you have GI cancer and you can't eat or drink, and even putting like a teeny tiny pill is eliciting nausea and vomiting, that's when sometimes inhalants, very small, as long as there's, it gets complicated because we have to be sure that there's no underlying factors or other risk factors. But sometimes that even is a useful modality from time to time. Drinks are great. They're much lighter than edibles. Edibles can be the heaviest. So there's lots of options, but start low, go slow. Don't consume a whole bag or a whole product of anything. Sometimes a well-meaning dispensary worker will sell something called RSO. It comes in a syringe to a patient, and it looks like one syringe is a dose for one time. It is not. That's about 300 milligrams of THC in it. So you only want to take a grain of rice. And I would not buy that on your first time out because it's going to be entirely too strong and there's just too much room to overconsume. And the other thing is there is a lot of positive research happening in cannabis at the laboratory level and preclinical level. However, if anybody says cannabis can cure XYZ, no, we don't have that data. And there are a lot of people who get really mad at me about that. And, is there patient stories out there that exist? Yes. I don't want to take that away from anybody. It is a newish science, a new plant that we don't really understand. We are seeing great things in research. There's a patient population of glioblastoma patients where in use with radiation and cannabinoids, they prolonged their life about 18 months to 2 years longer than their prognosis was. I think the population in that study was about 80 patients. That's pretty big. So we do see some really, really positive things where there's a future perhaps, but if anybody says this cures this, no, there's good, it is great for symptom control. And so if there's some secondary gains on apoptosis that, we're just unaware of, awesome. But right now I would say it's really great for symptom control. We have that literature and we know it's safe, but don't listen to anybody that's.
Well, and I think that that's one of the unfortunate things is that there is this middle ground, right? Like that there are the people out there that are kind of the equivalent to the snake oil salesmen who are, I think capitalizing on people's fears when it comes to cancer and their desire to find something to cure. But just because those people are being disingenuous in what they're promoting doesn't mean that there is not a place in as far as quality of life and side effect and symptom management that, I think something I think of is just like treatment compliance, right? If somebody is feeling better, and I say this whether it's about medical cannabis or tell your doctor about side effects if there is another medication, so that you're going to be motivated to stay on the course of treatment versus feeling like you want to skip a treatment or less keen because it's having such an impact.
Absolutely. Yeah. 100%. And when we work with patients, when I see research that says something very positive about the impact on an oncology patient in cannabis, even if it's preclinical. So I'll talk about what the research says about symptom control. And then as we're talking, I'll be like, okay, I found this. I just wanted to share it because, I think it's nice to tell people like, here's like a nice thing to hope for, like this could be happening. We don't know for sure, but hey, it was researched and it showed that this happened in one study, so this could be totally possible. Like I do share that with people, but I always am really clear. Like I absolutely don't want to provide any false hope, but I also know that positivity is really helpful with a prognosis. So anything I can do to help with positivity, I am game to say, especially if I read it, I always share it. And symptom controls a lot too in oncology care, right? Because sometimes patients do not so good if it's really challenging to get through a treatment course. So the more cycles that we can get in, the more doses somebody gets is important, and that they're not skipping it due to dehydration or sepsis. And not that cannabis can help with sepsis, certainly. Although there's some really interesting preclinical studies too there. But keeping folks out of the hospital and feeling good and a quality of life, like that's huge. And so if we can get folks through intense treatment with cannabis, that's enough. We don't need plants to do, it's a cool plant, but we don't need it to be like a complete
to do everything.
Exactly. Yeah. It can do a lot, but it doesn't need to do everything. Yeah.
Well, Rebecca, I'm looking at the time and I realize I stole a few extra minutes from you here,
I don't mind at all.
I so appreciate your time and your expertise on, I think, a topic that is of interest and growing in understanding. So perhaps we'll end up inviting you back again someday because there's so much we didn't get a chance to talk to you today. But thank you for being here.
Absolutely. And I'm always happy to come back. Thank you for having me. And yeah I'm always happy to be a resource too.
Thank you. And thank you to those of you who joined us today in the Zoom room and on Facebook Live. And those of you who are viewing this after the fact on YouTube. I don't know where you'll be in October, but I will be back here in October for the next staff chat. I believe it's on October 26th. Maybe Sabina will correct me if I'm wrong in the chat. But I thank you for being here and wish you the best over the next month. Take care, everybody. Take care, Rebecca.
Bye.